treated these days through drugs, partly because the insurance companies have looked at some of the research and decided they like the benefits of the drugs compared to the costs, and partly due to the fact that we have a for-profit drug industry that's busy creating drugs for mental illnesses. Surgery. Prefrontal lobotomy used to be done. You've seen the movie One Flew Over the Cuckoo's Nest, movies like that, talk about prefrontal lobotomies. Hopefully there aren't too many of them being done, but they're still legal to do. Electroconvulsive shock. Electroconvulsive therapy. So attach electrodes to somebody's head and give them a big electric shock, knock them out. The theory was that this would help with depression. If somebody had obsession, they couldn't stop thinking about something that was making them unhappy. Right? An obsession is a thought that the person can't stop having. A compulsion is an action they can't stop themselves from doing. So in the case of obsessive depression, the person couldn't stop. They thought sometimes so it's like a computer. You just turn it off, turn it back on again. That cures a lot of problems. They thought, give the person a big shock. They even used to put people into insulin shock in the old days. You may see that in some old movies where they give the person an injection of insulin and create a shock. Very dangerous thing to do. Nobody ought to be doing this anymore, but there's still people who might be still doing this. And of course, genetic counseling. Now you might have added maybe genetic therapy. Maybe they can discover some genes that can be fixed. These are things that are kind of like on the research edge, not really much in the realm of practice, but in the realm of maybe things coming, maybe epigenetic interventions that might be able to be done. That's not changing the genes, but changing those chemicals that control whether the genes are turned on. All right, name the 4 groups of psychological therapies. How many got at least the drugs up here? That's the number 1. Electrosurgery, electroconvulsive therapy, and shocks, and genetics. So those are the 4 biggies. The 4 psychological treatments, you've got the psychodynamic, the insight-oriented, the directive, the Freudian psychoanalysis would fit in this category. So that's one group. You've got the humanistic. That's the non-directive, the client-centered, the Rogerian kind of therapy. You've got the cognitive. That's like Ellis. You saw that in the video where Ellis, I think there's a bit of a tape of Ellis working with somebody trying to convince her not to be upset, that even if her worst fears were true, they weren't something that she should be upset about. So you try to correct the person's way of thinking about things and try to improve the relationship between cognition and emotion. And the 4th one was behaviorism. And that's where we are right now in the course. So we're going to get to behaviorism. You read a bit about it in, well, you read a lot about it in chapter 6, and you're going to be chapters 2 and 6. You'll notice they have asterisks on them. Those are more important chapters than the other. These are 2 that I've assigned you to do the quizzes. That's, I think, in homework number 12. If you haven't read chapter 6, now's a good time to get caught up and be sure to do chapter 6. Also for next week, I've assigned to be sure to reread the sections on statistics in CALIC that are in chapter 2. And we're up to behaviorism.